Hi, it's Dr. Quinn Throckmorton, and if you're watching this video, it means that we had a discussion in the office about an arthroscopic procedure in the shoulder. What that means is that we use a scope or a small camera to look inside the shoulder and investigate any problems that are going on, and then we use small incisions to do any work that might be done. And this typically involves cleanup type operations where, for instance, if patients have frayed edges of the rotator cuff, and while it may not need a repair of the tendon, sometimes we can just clean those up, and that's often much better for patients in terms of having a shorter rehab time and perhaps less pain after surgery. So in the interest of you having all the information you need, we're going to review the talk that we had in the office, and hopefully this will reinforce some of the things that we talked about. On the plus side of the surgery, about 80% of the time patients do well from this surgery, meaning that they're happy that they had it done and they're better than they were beforehand. And it's outpatient surgery. You get to go home the same day, so there's no stay in the hospital or anything like that. On the downside is typically about a 3-month rehab from these operations, and for the first 6 weeks you're usually in a sling, meaning you're not really using the arm at all. The second 6 weeks you're out of the sling but using the arm gently to do things like play with your phone or drive or take care of yourself. At the end of 3 months, as long as things go well, then you can use the arm without any restrictions. If any physical therapy is required after the operation, you can take that at whatever facility is close to home or convenient for you, and you will have a prescription given to you by us that instructs the therapist on the things that we want them to do. As long as they adhere to those protocols, then we're happy. The follow-up visits are at 2 weeks and 6 weeks. Those are with my PA, and he'll run you through the rehab program. You see me at 3 months after surgery, and as long as things go well at that point, then you can get rid of me for a while. For the first 2 weeks after surgery, even though you're in a sling, you do come out of the sling for some gentle activities in front of the body, and we'll instruct you on those on the day of surgery. It generally means that you come out of the sling and let the arm dangle in front of you and make about 10 circles with the arm going each way. But again, we'll review that on the day of surgery. Everybody is always concerned about pain after shoulder surgery, and so are we. We have studied this extensively over the last 10 or 12 years. Happily, we have come up with a pain management program that we feel has been pretty successful. We do an injection on the day of surgery, which is a long-acting anesthetic which lasts for about 2 or 3 days, and then you go home with 4 different prescriptions of medications that all hit the pain at different points in the cycle. This is called multimodal pain management. When we've studied this on numerous occasions, the pain that patients have on the day after surgery, which is usually the worst of it, is about 3 out of 10. So we feel that patients are able to be made comfortable even though surgery can be a painful experience. Finally, an important thing to know is that you'll have my card. It has my number. We're available if there are any problems that happen after surgery. The number is a direct line to my assistant who can always get in touch with me.